Good morning.
Good morning. So joining us, as you heard, we have Dr. Brittany Kaiser and Tim Johnson. This panel theme is around healthcare and blockchain RX. So Tim, before we can properly prescribe, we need to first diagnose. What are the current friction points within the healthcare system in North America?
Transparency would be one of the bigger ones. Our industry is really controlled by only a couple very big companies, and they control all the data. Having access to the data is a very difficult time for anybody outside of those companies. They won't share it, so that's a problem. Then the use of data in real time, because if you're a carrier or a risk taker, you need to see data often and frequently in order to price accordingly, and that doesn't exist today. The people today get their data within 3 to 6 months, and by that time the situation has changed so much that it's almost not useful.
You know, it's interesting you just said regarding these pain points. Now, Dr. Kaiser, you have spent the past number of years standing up to Liboli, standing up to Goliath to protect data. Talk about your relationship with health and tech and the HITChain, and why TON seems to be the best solution for the protection of the data.
So I've spent most of the past 10 years working on solving what I believe is the world's biggest problem, which is our data rights and the rights that we have in our digital lives. And that usually comes down to questions that are not very sexy, which is, do we have transparency and consent mechanisms and permission structures in the databases that we use across our personal lives and across verticals in our professional lives. And a lot of people don't realize that some of the issues that you just talked about and issues across a ton of different sectors come down to these base questions, which is, do we actually have control, ownership, and rights to our data? And whether that's personal information or information that is produced professionally, usually the answer is no. Usually the answer is the company that we are interacting with, whether it's a social media platform, a device, or even a hospital or a doctor's office, they own the data and they take the data from us, and we don't have any access rights to it, which slows down everything from health outcomes to ROI for your business to your ability to protect your own human rights while leading a digital life. So for me, answering these questions from a legislative and regulatory perspective has been taken the better part of a decade for me, and helping co-author a lot of the laws that solve these problems, but then also helping build the solutions. I'm currently CEO of AlphaTON Capital, Nasdaq ATON, where we are investing in the exponential growth of the world's most ethical technologies like Telegram and the TON blockchain, as well as privacy-centric AI. And we've partnered with health and tech, Nasdaq HIT, in order to solve these problems for the healthcare industry, which, if anyone here doesn't know, the healthcare industry in America is a series of human rights disasters, mostly caused by this data ownership issue, which we've been working together for the past many months to solve.
Telegram, I know a number of you in this room might use it. I'd like you to kind of talk about, Brittany, in the time that we have, and quickly, regarding Pavel, and how Telegram is a tech for good. Because when we look at how Pavel was arrested and clearly accused of many things, and yet some of us over the years have gone on eBay and have found items that shouldn't be there, or on WhatsApp, and it's not always used for good. Why do you think Telegram has been attacked?
Telegram has been attacked because it is not popular to refuse to give user data to governments. And it's not popular to decide not to sell user data to companies that want access to it. But Pavel has decided to do neither of those things. Unlike most of his peers, if you don't know, the top 5 most used apps in the world are WhatsApp, Instagram, TikTok, WeChat, and Telegram. One of those 5 is not like the others. How many of you have Telegram on your phone? Yeah, quite a lot of people in this room. A lot of you may use it every day, but you might not know that your handle, which is your digital identity on Telegram, you can own on chain. Pavel Durov and the Telegram team have vertically integrated blockchain into the back end, so that you can actually own your data and digital assets in Telegram. So your handle you can own on chain, you can buy, sell, trade it. You can do the same with private phone numbers, your .ton URL, and that means you actually have ownership. And because Telegram is not selling your data to companies or governments, it is a place where you can actually have an ethical technology interaction with a messenger and a huge social media giant. So that's a huge opportunity, why I'm such a huge investor in the Telegram ecosystem, and why we're so bullish on taking those technologies to different verticals like the healthcare space, where owning your data and having access to blockchain-based technologies, where you can own your ones and zeros, where you can encrypt data, where you can have HIPAA-compliant ways to transfer data to make everything faster, more compliant, and have better health outcomes for individuals.
Now, Tim, you are a CEO and founder of a publicly traded company with a market cap well over $100 million. You are not a Silicon Valley CEO. You're more like a Farm Valley CEO founder. The HITChain. What do you envision it becoming over the next 12 to 24 months?
Very similar to what Brittany's talking about. I created health and tech. I started health and tech on my couch, the idea on my couch, just myself, 20 years ago, because I had my own healthcare event where trying to have access to my information when I wanted it, how I wanted it, was impossible. So I came up with the idea, and eventually what I really want to have out of it is that everybody in the US, we legally own our health information. It's my PHI, personal health information. It's mine. Unfortunately, it's been challenging to find a place where the individual can manage it, right? The technology wasn't there back when 1982 when Clinton passed HIPAA. The P was portability. That's what it was stood for. It's never been able to manage that. It hasn't happened yet. What we're trying to create is to solve the portability issue for the individual. The individual will now have access to that data and be able to share it with the doctor or whoever they want to share it with, very securely online, whether it's an app or your computer, whatever. That's what I want out of HIT.
But we're not limited to only North America or the USA, Dr. Kaiser, correct?
Oh yeah, absolutely. I mean, everyone around the globe can benefit from this. I think a lot of people here are probably European, and you are very familiar about what Estonia has done over the past decade. They're not the only government that has gone very digital, but they were the first to go fully digital, and they were the first in the entire world where everyone in Estonia has a digital ID, and if you go into a doctor's office, you can check in with your digital ID, and your doctor gets temporary access to all of your healthcare data files so that they can care for you in the best way possible, and you have the best health outcomes. And they can only add data. They can't change, modify, or delete data that is in your health file. They just add more data so that the next time you go to the doctor's office, all of your information is there. And when you leave, they lose access to your data file. How intelligent is that? How simple does that sound? Unfortunately, most governments around the world and most private healthcare systems don't have anywhere near as advanced technology as this, and it's still incredibly cutting edge.
You know, it's interesting, in the United States, how many Americans, by USA, not all of North America, but how many Americans do we have in the room? We have a couple. We have the most expensive healthcare system on the planet. And Tim, it's interesting because you're in this legacy sector, and I'm in it with you, that has been controlling this more as a monopoly, as you and I were talking about off stage. So why do you think the monopoly has been allowed to continue?
States, it's about control, government control. Each state gets to dictate the terms for the insurance carrier in their state. They actually have it in most states' constitutions that they allow monopolies, and then the monopoly in the healthcare system in my state in Iowa, they allow a healthcare monopoly. And that healthcare monopoly, they have 98% of the business because the state wants to control what happens in that, in our state. They want to happen what healthcare, how do you get healthcare, what's covered, what's not covered. So that control is what they're really looking for, and they allow these monopolies. The federal government has a different health system, and you can buy health insurance two different ways in the United States, either fully insured or self-funded. The federal government allows for much more flexibility. The sharing of information, they've never really dictated how we do it. So what we're trying to do at Health and Tech is to create a system that shares this information, before they start to understand how much control they could put on it, I'm really starting to create a system that allows everybody to have access to it before they step in and stop it.
You know, it's interesting, this idea of a monopoly, Dr. Kaiser, is that in the U.S. healthcare system, it is so expensive that the government had to create a subsidy program to subsidize the cost. So using HITChain as this new partnership and relationship now kind of goes this next level, how do you see the ton chain allowing these payments, so to speak, on blockchain to drive down future costs for the consumers?
Well, what a lot of different industries, not just the healthcare industry, have issues with is that they're using legacy technology as the main daily use for their database. And so these databases are not connected to each other. There's no tracking and traceability. There's no transparency into all of the different data silos where data is being collected and not shared in real time. Sometimes it's not even being shared in weeks or months. And in the healthcare industry, this costs lives. When people are waiting to be reimbursed for a medical expense, when they're waiting to find out if their health insurance will approve a certain type of procedure. This is a huge problem in the United States because of the way our healthcare system is built, but this also still happens around the world. You're waiting to find out if your national healthcare system run by the government is going to approve you, if you're going to get an appointment. And this usually is down to database issues, because as soon as you input that you are in need of something in particular, then there's an application process. It goes into some sort of data silo, and it doesn't get to the decision makers who can actually approve you, get you an appointment, and get you the care that you need. So being able to use blockchain technology where you have near instant transactions, where you also have data protection compliance and privacy-centric architecture. For those of you that don't know, the TON blockchain, which is integrated into the back end of Telegram, is highly scalable because it was built specifically for one of the world's largest messaging apps around the world. It has what's called infinite sharding architecture, meaning that when the data is sent, it goes into infinite shards. So if someone were to try to attack it and hack it, they might only get access to one shard, which would not allow you to put together the information again. You wouldn't get access to all of the other pieces. So for data compliance, it's an incredible tool, and that's why it's in the back end of Telegram. So for us, repurposing that for the healthcare space, really easy to be HIPAA compliant, GDPR compliant, and to provide people with the best outcomes possible with near instant transmission of data and your ability to not only access that yourself, but for all of the different silos across the healthcare ecosystem to also be able to use that as well.
So I had this conversation yesterday with this gentleman, Levon, the founder of a company called InfoPay, talking about partnerships. He and I were talking about data. What sort of partnerships would HITChain benefit from? So for all of you, you all are very smart, very wise. A number of you are very good looking as well. Talk about partnerships. What sort of partnerships would the HITChain need, and those that might have access to it?
Yeah, HITChain will be a decentralized platform where obviously it's healthcare, so you have providers, every sort of provider, every risk taker, which is our insurance companies, the health companies, but then there's a litany of other vendors that provide medical management services, teledoc services, all of those services. Those are all partners, and they will be connected to HITChain. They want access, they'll provide a service, they'll have access to that data in real time. One of the things that we're expanding on is obviously there's so much money, as Dustin was saying, it's so expensive. We're working with some other payment providers, some debt companies, because hospitals carry a large amount of debt. It's uncollectible accounts receivables for them because the patients have a hard time understanding what the patient responsibility is, because, as Brittany was saying, the time that comes around, they don't trust the system anymore because everybody's told them they owe all this money, and they're like, I've paid it 3 times. They're like, well, it doesn't show up in my records. Well, now it will. It'll be real time, so they'll know what it is, so they'll make the payment. But we still have a lot of people in the U.S. who can't afford their patient responsibility. So we're even talking about working with payment vendors. How do we make the payment quickly? We're going to use stable coins to make the hospitals really appreciate getting paid fast. We're going to pay within minutes versus months. There's so many different vendors along all those chains that we're going to be working with.
So talk about that a little bit, Dr. Kaiser, regarding this claim-back finance protocol aspect of the HITChain.
Well, what is incredibly exciting is just like data silos, there are also money that ends up in silos. And so there are people that are paying for healthcare services, there's hospitals, and then there's the insurance brokers, and then there's everybody in between. And usually there's large debt on some books and a large surplus of money on other books. And there's different bidding systems that right now create a system that makes this whole process take months for a claim to be put into the healthcare system and for the payment to be finalized of who owes what, and for the hospitals, the doctors, and the individuals who are receiving the care to get paid and to receive the care. Months. I mean, that's an insane process when if you actually connected the databases together correctly, you would be able to say, okay, there's this type of healthcare service that is needed, and this hospital is going to be providing it, and this insurance provider approves it because it's an approved service, and all of those people could get paid what they are owed by the right entities, and immediately there could be settlement and a booking for that particular service. That would change so many people's lives, not just in the United States, but around the world, that thinking that these problems are just down to database architecture seems insane, but it is actually true. So the opportunity to make all of those processes seamless, to make them fast, instant, transparent, where everybody knows exactly what is happening in each part of the process, it is actually revolutionary. It shouldn't be, but it is.
Yeah.
And as we go now to the final, it was like 2 to 3 back up. For you, Tim, as you now have been going from legacy and more of like the traditional tech now with moving over to blockchain, what's this been like for you?
It's been eye-opening. I'm not technical. I just have the idea on what I want to fix. I'm a builder by nature. I don't know how to program. I don't know any of that. Last night, Brittany and I were talking, and half the things coming out of her mouth I didn't understand. But I know what I want out of it, and that's the difference. I know what the solutions are, I know what the problems are, and I know how to fix it. But I don't technically know how to do it, so it's very enlightening to come to conferences like this and listen to everybody talk.
You know, the first time I met you, Dr. Kaiser, was about 5 years ago during the filming of a crypto documentary series. And you have this really unique way of taking things that are very complicated and dumbing them down for Dustin. So to finish this out today, what is Dr. Brittany Kaiser learning today?
Today, I have learned that there are such huge opportunities all around the world to solve what seem like huge problems, but actually when you get into the detail and the nitty-gritty of it, it's a very simple problem. And the reason why we're all at Web Summit is because it is usually a technical fix. And that's why for the past decade, my obsession has been, if you fix the data, whether you're fixing the quality of data, the rights to data, ownership of data, data flows, database architecture, then actually all of the knock-on effects that everyone experiences usually, again, comes down to what information does who have, is it real time, is it data that is hygiened, is it the information that is required, is the data talking to each other? And if you fix those, you really can solve a lot of the world's greatest problems, functionality with public and private organizations, governments, nonprofits, companies. So for me, making sure that the right technical architecture and the right technical assistance is available to different industries and verticals around the world, and especially to governments, so that they have the technical expertise in order to execute and solve these problems for their citizens, for customers, for users, and in general for individuals around the world, has been my passion and my focus, and really excited especially to bring this type of technical expertise to the healthcare industry.
Thank you, Dr. Brittany Kaiser. Thank you, Tim Johnson. Thank you, everybody, for joining us for Blockchain RX.